All right. Peace and blessings, all praises to the Most High. Imagine taking your 2-year-old son into a dentist's office for simply getting cavities fixed. And the next thing you know, the doctors are coming out of the back room after you waited 45 minutes and telling you that your son is at a hospital 30 minutes away. And you get to the hospital and you find out that your 2-year-old toddler son is dead. That's right. This actually happened to a couple. Just take a listen to this news video and see the outright disregard that they had, first of all, for the child and also for the parents, as these dentists in Valleygate Dental Surgery Center in Greensboro, North Carolina, killed their son.
Hard for any parent to hear. A Salisbury family is grieving tonight after they say their 2-year-old died during a dental surgery procedure. Thank you so much for joining us tonight. I'm Kim Anderson.
And I'm John Carter. The inevitable question, how could that happen? Well, WBTV investigative reporter Naomi Coles digs deeper into the story.
Ermias Mitchell was David and Sharde's miracle baby. His mom had been told she'd never have children. This video, taken early Thursday morning, is the last time his parents saw Ermias alive. The 2-year-old was at Valleygate Dental Surgery Center in Greensboro to get teeth caps. Not long after his dad took this video, Ermias was taken back for his procedure. His parents waited in the lobby. His aunt explains what happened next.
She FaceTimed us. Usually when Sharde FaceTime, something is wrong. She said, my baby not breathing.
The parents say they saw an ambulance outside come, then go. 40 minutes after Ermias had gone in for his procedure, staff came to tell them something had gone horribly wrong. By then, David and Sharde say Ermias was already at or on his way to a hospital 30 minutes away. The parents had to rush to him alone and too late to say goodbye.
You sat there, you waited, and you never notified his parents. You never notified them. Then you took this baby alone in an ambulance. And you're going to tell them they need to go to the hospital. The hell?
Greensboro police have opened an investigation into a child's death at the address associated with this dental center. That's all they can confirm for us so far. I've asked Valleygate Dental leaders for answers about why the parents weren't notified in time to go with their child to the hospital. They said they could not comment on specifics, but were actively reviewing what happened. And that while rare, quote, complications can occur unexpectedly, even under carefully controlled circumstances.
I'm mad as hell because he was only 2 years old. The facility needs to be shut down, period.
Answers will help, but they won't bring Ermias back to a family left reeling with pain.
This baby was going up there for dental work. It ain't like he was having an open heart surgery.
I am continuing to push for answers on what went wrong with this procedure to begin with. The family tells me they weren't made aware of any risk beforehand, and the child had no known health issues. Valleygate Dental has oral surgery centers across North Carolina, including right here in Charlotte. Reporting in the newsroom, Naomi Coles, WBTV, on your side.
So tragic. Thank you, Naomi. Naomi also learned today the North Carolina Dental Examiners Board is investigating this death.
Yeah, the family told Naomi, the doctors told them the child's death involved anesthesia and a collapsed lung.
Naomi spoke to the executive director of North Carolina's dental board, who told her there have been 8 oral surgery deaths in North Carolina in the last 13 years since stricter anesthesia regulations went into place. He believes this one is the first pediatric death during that time frame. For context, the director estimates anesthesia is used between 300,000 and 400,000 times a year in North Carolina dental practices.
Our first job as a board is to determine whether the death occurred as a result of bad dentistry, over which we do have jurisdiction, or if it was a result of anesthesia that was provided by the center itself. And if that's the case, that's not our jurisdiction. And we mourn with the family. Gone to a surgical center thinking everything would be okay, and then have it come to such a tragic end.
If the investigation ultimately points to the anesthesiologist, the North Carolina Medical Board would likely get involved, but they told Naomi today they couldn't confirm or deny if they were investigating at this point. Now, we're also waiting on records from the state about the facility's licensing history. We're going to stay on top of this story in the days to come.
Now, can you imagine going through that situation? Now, you see that David and Sharde Mitchell are a young black couple. And Ermias was 2 years old. They actually thought that they couldn't have a child. So he was actually their miracle baby. And when they took him in, you saw the video that he was lively, he was playing, wasn't nothing wrong with him. And they took him back. They said the last time that they saw their son alive was when they took him back, or they gave him to the dentist or the anesthesiologist. Now, first of all, 2 years old, they should have at least allowed the parents back there, because the parents said they weren't even told that they can accompany their child. Now, of course, I mean, I would have demanded to be there with my child. But of course, a young couple, they're figuring, okay, these guys know what they're doing. It's going to be very simple, and we're going to be in and out. He's going to be better. He's going to have his caps. That's going to be the end of the situation. Now, 40 minutes, 45 minutes to an hour later, they sat there. They sat there. They sat there. And they said they heard ambulances, sirens come to the facility. They came and left. All the while, this couple not knowing that their child is being transported to a hospital because there was a problem with the anesthesia. They're saying there was an anesthesia problem and a collapsed lung. Now, how do they know that beforehand? They're not, physical doctors. They're anesthesiologists and dentists. So they don't find that information out until they get him to the hospital. By the time he gets to the hospital, young Ermias is already dead. And these people, they didn't even have the decency to come out and say, look, there's a problem. Come back here, ride with your son to the hospital. You know why? Because I think they knew they messed up, or they may even have purposely messed up. And I'm going to tell you why about that in a minute, because I've experienced something in that Greensboro area that I feel was a personal, deliberate loss of life to a child. Now, once again, I looked up the Valleygate Dental Surgery Center, and I didn't bother to call because I know they weren't going to answer any questions. But this is who they have as the medical director. Take a look at this lady, and I'm going to read you her bio. This is Emily Williamson. She's the medical director. Dr. Emily Williamson is a respected anesthesiologist, acts as medical director for Valleygate Dental Surgery Center of Greensboro. Williamson grew up in Trinidad before moving to the southern United States at the age of 6. As a dedicated anesthesiologist, Dr. Williamson is a proud member of the North Carolina Society of Anesthesiology. She is passionate about providing compassionate care, supporting patients through some of their most challenging moments, and help to ease their fears and discomfort. How, Sway? How are you committed to those things that you just said, Dr. Williamson, when your staff, when the people under your tutelage, or you yourself, when you realize that this child was having, whether it was a relaxation, whether you gave him too much anesthesia, which is possible, how in the world could you not inform the parents that something was wrong with those child? And once again, I cannot ignore the racial dynamics of the situation. If that would have been a white couple out there, they would have immediately told those white people what happened. But nevertheless, the last time that they gave little Ermias to those dental people, that was the last time that they saw him alive. Now, the facility released that blanket statement. Let me read that to you. Our thoughts are with the family and loved ones during this unimaginably difficult time. The health and well-being of every patient is our highest priority. Our staff includes an array of highly experienced and board-certified physician anesthesiologists, certified registered nurse anesthesiologists, and nurses. Our professionals are dedicated to providing a caring, nurturing environment where comfort, dental health, and safety are of primary importance. What does that have to do with what happened to that young man. And you heard the reporter say when they asked about why they didn't notify the parents, once again, they hide behind legalities. Oh, well, we can't comment on specifics at the time. That's not a specific. That's a general logical question. Why didn't you let this family know? And so then again, these medical facilities, they can hide behind responsibility. You heard the last expert say, well, now it's time to determine, was it a problem with the anesthesia that was received from somewhere else, or was it a problem with the medical center, administering the anesthesia? Now, if it's a problem with the medical center administering it, well, we can't get involved. But if it is, with the distributor, then we can't. But if it is, then that's going to be, something for the medical board to decide. Now they're saying, okay, well, we don't know which one is being investigated right now. But I think this is a case of probably or possibly even outright murder. And let me tell you why. If you're familiar with the area of Greensboro, I was dating a lady in Martinsville. This was about 10 years ago. We found out she was pregnant. She was staying in Martinsville, which is only about 45 minutes from Greensboro, Martinsville, Virginia. And so we would set up the appointment. She was pregnant. We would set up the appointments and she would go down to Greensboro. And, I would come from Virginia Beach, ride with her to the doctor's appointments 2 or 3 months into the pregnancy. But as you're coming from Virginia to Martinsville, you see a large Confederate flag on the side of the highway. If you guys ever been that way, you know what I'm talking about. And so we get to this prenatal care, somebody who I guess somebody referred it to, whatever, but there's this just mean looking, almost like a German, like it almost looked like, I guess, one of those German people who would, sterilize and mutilate Jewish women when they were going through the Holocaust or something. But, I remember one time when she was doing the little examination, like she was doing like this. And, my girlfriend at the time, her private area, like she had the little thing and she was just jumping and she looked like she was just up there. And I'm looking like, this don't look like, it looked like she was purposely trying to destroy the fetus. And the next time we came, sure enough, like after that, a week later or 2 or 3 weeks later, when we went time to the next appointment, my girlfriend was like, man, something's wrong. I feel like, something. And the next time that we got there, the next appointment we went, by the time we were supposed to go back, but when she went into the bathroom, the fetus came out. But I think back on that now, and I see the look and the anger in that white German, she was built like the German swim team, if you ever remember them. But she just literally just rammed the stuff in. I'm like, this can't be good. And I feel in my heart today that she literally destroyed that child, my unborn child. And so that's something, once again, this happened in Greensboro. And once again, the whole North Carolina is rife with the Old South belief. And so Valleygate Dental, I think they are definitely responsible. They owe this family more than an apology, because you can't bring the son back. And this lady, that is Dr. Emily Williamson. And there's another, she is the medical director. Then there's the dental director, and that is Amy Kinlaw. Now she is the dental surgery director. There's no picture of her. Maybe they took her picture down. But if you guys want, you know what we do on this channel. We call and let those people know how we feel about what's going down and how they're trying to hide behind investigations and things like that. Whatever happened, there is no excuse of you not letting that family know that their child was experiencing a medical emergency, and we have called the ambulance, and he is on his way to the ambulance. You get in the ambulance and ride with them. I believe that the child may have been already passed, by the time they even called the ambulance. And that's why they didn't let the family know. But once again, prayers out to the family. David and Sharde Mitchell, rest in peace to young Ramirez. This is just another example of medical racism. Like I said, in the 70s in Kinston, North Carolina, we've been following Kinston very, very much lately. They were sterilizing Black women without their knowledge, right in Kinston. This is 50 years ago. Like, this ain't, the 16 or 1700s. And so there is still that eugenics mindset of a lot of people that feel that Blacks don't supposed to reproduce, and we have to do everything in our power to keep them from reproducing. And after they reproduce, we have to even take their children in manners like these. So once again, shout out to the family, and woe to Valleygate Dental, whatever they call themselves, but definitely you guys know the location, Valleygate Dental Surgery Center in Greensboro, North Carolina. So if you guys want to let them know how we feel, you know how we do. But y'all see my number, 919-587-7782. Thank y'all for watching, liking, sharing, and subscribing to the channel. But most of all, peace and blessings.